Pfizer, you'll sign on. If we could get 1 million doses that worked right away, that'd be a good problem to have, wouldn't it? Then we'll figure out where the most pressing needs are globally, right, Doctor?
Yeah, look, it's going to take time to ramp up that supply. You're not just going to have 1 billion doses overnight. They're doing some advanced manufacturing of these vaccines right now, so they're going to be manufacturing at risk. So if any of these vaccines are successful, they should have a lot of doses available. Moderna, in particular, is using a contract manufacturer, Lonza, here, so they're not controlling the manufacturing process. But, hopefully as they make the transition from the research stage manufacturing to commercial stage manufacturing, they can do it seamlessly and have the supply on hand. Just as an aside, one of the things that happened in 2009 with the H1N1 vaccine, when we went to manufacture it, we actually ran into a hiccup. It took much longer to manufacture the doses as we converted to commercial stage manufacturing. It delayed us about 2 months.
Your latest op-ed, just trying to summarize, if I had to just in a couple of sentences summarize your point, I guess it's that the public really, before the government gave a lot of guidelines, the public had pulled in and had basically stayed home and wasn't going out. And a lot of states aren't ready to open up right now in terms of federal guidelines, but they are anyway, and that's partly from the public as well. It's not a second wave that we're seeing in your view, but we still need to be ready for outbreaks and just, I guess you're just saying be flexible in how we try to do this, because it's not going to be perfect, it's going to be very uneven.
Well, look, the point is there's a perception that the government shut down the country and then the government reopened the country. And what happened was people shut down the country and then people reopened the country. And the government sort of came in with rules that formalized what people were doing. If we hadn't shut down when we did, we certainly would have when we reached 3,000 deaths a day. People were starting to close down businesses. And I said last week, the NBA shut down the NBA, and it shocked people when they did that. But a lot of businesses were following suit at the time, and the government came in with rules that sort of formalized what was underway. And we really reopened against the backdrop of more spread than what was prescribed in a lot of the reopening plans. But people were getting tired of the shutdowns, and the government sort of formalized what was happening informally anyway. And so the point is that you need the support of the people really to make this work. We need to have the public invested in this. And that means things like, encouraging mask wearing and everyday common sense procedures that if people engage in on a wide scale, it can cut transmission of this virus. If public officials sort of discourage these practices or don't engage in them, don't lead by example, and people don't engage in them on their own, then we're going to have more spread. We seem to be complacent to some degree with 20,000 cases a day. That's an awful lot of infection. That's why we're seeing these flare-ups and these outbreaks. This is going to become the new norm, these kinds of rolling outbreaks, if we continue to have this level of infection around the country.
Well, what can we do about it? And why should we not be more concerned about Arizona or about hospitals being taxed to the limit in some of these areas where we're seeing even hospitalization and ICU go up quite a bit? Shouldn't we be more concerned that we are? You've always been kind of calm about it, that this is something to be expected. Where should we be on a scale of 1 to 10 on how concerned we should be about this? Is it going to turn into New York and Texas?
Well, probably not is the answer, but it has the potential to. So we need to be very concerned about it. They have more testing in place. So you have a better sense of what the overall disease burden in these communities are. California right now has 3,700 cases. At its peak, New York City had 5,000 cases. But we know at the peak of New York City, those 5,000 cases were just a fraction of what was underway. Now they're probably turning over a good percentage of the cases in Los Angeles and California where the outbreak is. So we have a better sense of what's going on. But this could quickly get out of control. And what these states need to do, these cities need to do, is do good contact tracing, not to find every individual who's infected, but find the sources of the infection, the activities that are leading to the infection, and take targeted mitigation steps. We're not going to be able to shut down the country again this summer. We're probably not going to be able to shut down the country again this fall. And so we're going to need to try to isolate the sources of these outbreaks and take targeted steps. If we can't do that, these will get out of control. And so the cities need to be adept at this. I think Arizona, you're going to see Arizona potentially take control away from the counties for the contact tracing work. You're going to see the states step in. These states need to be doing good contact tracing work to isolate the sources of these outbreaks.